Welcome to Includi, the online marketplace addressing loneliness. Do you have clients or participants that show signs of loneliness? Are you looking to innovate your services to deliver an edge in the market? Would you deliver a new program if it meant no increase in headcount? If you can relate to any of these, please stay tuned as a breakthrough solution awaits you. You see your aged care and NDIS base suffering from loneliness and want to do more to help, but there doesn't appear to be anything new available to improve quality of life. You may have tried asking a few more questions during welfare calls, but you don't notice any real progress in their outcomes. You may not be able to visit people to check up on them during lockdown and want to find a new way to deliver meaning to their lives. When you look at the tools available to address loneliness, you realize that connecting a stranger to another stranger delivers unpredictable results. You don't see progress in the person's quality of life improve because they are not working towards a goal. With all that's going on in the world at the moment, it might be time to try something new that enables you to deliver value, even if you can't visit in person. Also, you're looking at the next calendar year and thinking about what your organization can do to differentiate yourselves in a very crowded market. How do you stand out? Introducing Includi, the online marketplace addressing loneliness. Includi leverages many proven technologies and applies them to aged care and NDIS groups to deliver a simple yet powerful service. Includi takes the heavy lifting out of addressing loneliness. Don't worry, the Includi team will help you develop marketing materials to share the new approach with your base, to prioritize their needs in this area. Once a client or participant is signed up, we match them with AHPRA-registered independent allied health workers, as well as volunteers, who are vetted and act on your organization's behalf, to start working for a better tomorrow. Through Includi's proprietary matching algorithm, we ensure that the allied health workers and volunteers are a good fit, based on hobbies, interests, and abilities to help your clients and participants. This virtual team that is chosen for your individuals works on your behalf like a subcontractor once you approve them. From here, Includi services are delivered, and payment is made for service delivery via your organization through the platform, leaving enough for you to grow your revenue with very low risk. What is the client and participant experience like? During sign-up, they go through some quick questions about their hobbies, interests, and background, maybe a profile pic, and then they are listed on Includi. From here, some instant matches of allied health workers and volunteers are presented for your team and clients to consider. To ensure your clients and participants have no hassles in booking a slot, a small group of 2 to 4 allied health workers and volunteers are chosen, and their first Includi group is established. Once your organization approves the matches, the first appointment is made. An initial assessment is undertaken to determine which cohort the person fits into. For example, high needs and companionship, or open to social upskilling, or open to self-management with some coaching. It all comes down to the aspirations, goals, and capabilities of the individual. A truly tailored approach. As a provider, you're in a prime position to add new services like never seen before to Australian aged care funded and NDIS recipients. You are driving a competitive advantage, ensuring your organization will continue to deliver value for years to come, all without adding headcount. Your bottom line improves as you share revenue with the allied health workers and volunteers for each session. Volunteers will be able to allocate their rewards to a charity of their choice on Includi, or have merchandise allocated to them, so they can wear the Includi brand with pride to help spread the message. It's important to note here that there are still costs associated when a participant or client chooses a volunteer-led session, so reduced charges will apply to cover these costs. The founder of Includi, Anton Kusch, has spent more than 20 years innovating in healthcare, from worldwide surgical training systems to creating a range of digital health solutions in primary care for patients. His focus has been on leveraging proven technologies in novel ways to improve access to healthcare. Includi is connected to a number of loneliness efforts across the world and in Australia is engaged in co-design with providers to ensure we have a strong market fit, right from the start, to improve the quality of life for your clients and participants. The includi team has engaged with some providers to better understand the needs of the market. Go to includi.com.au and find our latest report on what tools do providers need to address loneliness. The results may surprise you. If you would like your organization to be an innovator of services, fill out the expression of interest form on includi.com.au, and we will be in touch to help get you started. Welcome to includi, the online marketplace addressing loneliness.